Ever wonder what's causing that weird numbness or tingling? Let's break it down from blood tests to brain scans, because guess what? Your nerves have a story to tell. Hi, this is Dr. Rezaian, a specialist in arthritis and autoimmune diseases. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check information with trusted sources. Step 1. Start with the basic labs. A complete blood count to check for anemia, infection, or even leukemia. Comprehensive metabolic panel tells you about electrolytes, liver, and kidney function. Hemoglobin A1C screens for diabetes. Thyroid-stimulating hormone helps rule out hypothyroidism. Vitamin B12 and folate, low levels can cause nerve symptoms. Step 2. Run targeted labs based on risk factors. Vitamin B6, especially if taking supplements or isoniazid. Serum protein electrophoresis and urine protein electrophoresis to check for monoclonal gammopathy of undetermined significance or multiple myeloma. Antinuclear antibody, erythrocyte sedimentation rate, and C-reactive protein help detect autoimmune or connective tissue diseases. Tests for human immunodeficiency virus, hepatitis B and C, and Lyme disease if there are risk factors or systemic symptoms. Heavy metal screening for things like arsenic, lead, or mercury, especially if exposure is possible. Step 3. Time for electrodiagnostics. Electromyography and nerve conduction studies tell you: is the problem axonal or demyelinating? Is it length-dependent or focal? And is it motor, sensory, or mixed? Step 4. Go specialized if needed. Genetic testing for early onset or family history of neuropathy, like Charcot-Marie tooth disease. Autoantibody panels like anti-myelin-associated glycoprotein or anti-HU if you suspect paraneoplastic or immune-related neuropathy. Lumbar puncture if conditions like Guillain-Barré syndrome or chronic inflammatory demyelinating polyneuropathy are in the differential. Magnetic resonance imaging of the brain or spine if a central lesion like multiple sclerosis or a stroke is on your radar. Bottom line, start broad, then zoom in. Let the symptoms and risk factors guide the next move. And remember, your nerves might be dramatic, but at least they're giving you clues.